I'd like to I'd like to share with you what's most likely to work to improve your sleep, and how to keep great sleep going as you age. I'm going to share a little bit about myself. I'm a certified sleep therapist. My training was through UC Berkeley's program. They have a sleep and mood disorder clinic out in California, and they were kind enough to allow me to join their professional training. They got a National Institute of Mental Health grant to train sleep therapists to work with the public. It is primarily cognitive behavioral therapy for insomnia. And so my treatment that I do with people does not involve medications, but because I'm an occupational therapist, I have a pretty strong background in physical medicine. I'm an occupational therapist right now. I'm also a licensed massage therapist, and I am trained as an aging in place specialist. My own sleep when I was younger was just about perfect. Like a lot of younger people, I could sleep anywhere and sleep without any problem. I would put my head on the pillow and wake up in the morning. That didn't last. In fact, just as I started to get older, the pandemic happened, and that did not do anything for my sleep. It made a lot of things in my life harder. And I wanted to know why, why someone who had such a great record of sleep would now struggle to get 6 hours of sleep. So being an occupational therapist, I figured there has to be a good reason for this, or many reasons. And that's when I looked into the training program and I was accepted. So the first thing I'd like to do is a true false quiz. So if you have a piece of paper handy, you might want to write down the numbers 1 through 10. So don't shout out an answer, just write down true or false to these statements, and then I will go over them. And hopefully that if you didn't come tonight with questions, it'll stimulate some questions and maybe some discussion later on. So number 1 is older adults need less sleep than younger adults. True or false? 2, sleep quality over 50 remains strong even if you don't get as many hours of sleep. Number 3, it's normal at every age to awaken multiple times per night. Number 4, lower melatonin in older adults is caused by spending less time outside in daylight. Number 5, poor sleep causes some forms of dementia. Number 6, every adult, even those with chronic pain or dementia, can improve their sleep. Number 7, naps are necessary if you have insomnia. Number 8, medications for asthma, anxiety, and migraine don't have much of an impact on sleep. Number 9, reducing screen use first thing in the morning can improve sleep. And finally, number 10, light boxes are safe for anyone to use as long as you don't sit too close to them. All right, let's see if I can see the chat. All right, if you want, you can put in a comment, but we will be discussing everything that's on this true false quiz. So number 1, older adults need less sleep than younger adults. I think the person who said this best was Matthew Walker, the author of Why We Sleep. He works at UC Berkeley. He is part of this, the program in the psychology department. And he likens this to bone density. In other words, we know that a lot of older adults get less sleep, but we also know that older adults also have lower bone density. But that doesn't mean they don't need good bone density. It just means they have it. So the answer is no, false. Older adults need essentially as many hours of sleep as younger adults. Teenagers and children do need more hours of sleep, but by adulthood, it's about 7.5 to 9 hours. Over 9 and under 7.5, we start to see changes in abilities and health. Number 2, sleep quality over 50 remains strong even if you don't get as many hours of sleep. Unfortunately, that is not true either. Sleep quality, meaning the depth and the sustained high quality sleep, weakens with age. And the part of sleep that gets damaged the most is deep sleep. By 80, I believe you have 20 or 30% of the amount of deep sleep that a person in their early 20s has. It's normal at every age to awaken multiple times per night. That is true. We know that that is true through every lifespan. Babies do that, teenagers do it, and older adults do it as well. You may not be aware that you are awakening. Your bed partner might realize you have rolled over or made some sort of sounds and gone right back to sleep, but it is such a light awakening that you fall back to sleep or not. Number 4, lower melatonin in older adults is caused by spending less time outside in daylight. That could be true. And for residents of nursing homes, assisted living, people who are shut-ins in their own homes, that there's certainly a loss of melatonin because they are not exposed to daylight. But the primary reason that melatonin, circulating melatonin goes down is because the gland that secretes it in the brain, called the pineal gland, starts calcifying. That's not good because a calcified gland cannot secrete the hormone melatonin. Number 5, poor sleep causes some forms of dementia. We have not yet found definitive proof. We know that people with dementia sleep very poorly. They sleep generally very strangely. They sleep too much, they don't sleep enough, they sleep and wake violently and can become violent, or they can be completely disoriented for a long time after they awake, but they haven't actually proven it. The association is pretty strong, and if you go on YouTube and search for any of Matthew Walker's lectures, and there are many of them on YouTube, he will say that the suspicion is indeed that poor sleep contributes to dementia, but the jury's still out on that. You really can't say definitively that it has been proven. But the good news is that number 6 is true. Every adult, even those with chronic pain or dementia, can improve their sleep. There are so many different ways to improve sleep, and the more challenging your problems are, the more creative you have to be. Low-hanging fruit, big changes, it will all make a difference. And so most of my talk later on this evening is going to be about those things that you can do. Number 7, naps are necessary if you have insomnia. Naps are actually not a good idea if you have insomnia. The reason is fairly simple. And it turns out there's a ratio. For every hour that you nap, you will push back your brain's desire to sleep by 2 hours. It's a 1-to-2 ratio. So even though people with insomnia are often very tired during the day, they are challenging their biology by taking an extended nap. And in fact, if you truly have insomnia, we don't recommend napping at all, even for a short period, but we'll talk more about naps later. Number 8, medications for asthma, anxiety, and migraine don't have much of an impact on sleep. That is false. Those medications for those disorders can have massive challenges. They can be sedating, they can be alerting. Mostly they are alerting. Asthma medications and migraine medications often make it much harder to either fall asleep or stay asleep. And some of the medications for anxiety are exactly the same. In other words, they might sedate you so that you can fall asleep, but then you wake up and you're unable to fall back asleep. Number 9, reducing screen use first thing in the morning can improve sleep. That is true. We know now that it is not just the problem with blue light. If you own an iPad or an iPhone or an Android device, there, there's a setting called, I think it's like night light or nighttime, where you can reduce the blue light. But what we know is if the first thing you reach for when you wake up is your phone or your iPad to check your social media, your brain has already been lightening your sleep before you go to sleep in order, anticipating that juice, that charge, even if what you're looking for is a negative message. I'm going to answer number 10, and then I see that Michael Feinstein has a question in the chat, and I will respond to that. Number 10, light boxes are safe for anyone to use as long as you don't sit too close to them. You can see my light box over here, this big ugly thing. That is a clinical grade light box. You can get them on Amazon. There's no prescription required. The question is, quite frankly, should there be? Because for some mental health and especially eye conditions, that light box could be harmful. So I always tell people, before you buy one, before you use one, please speak to your physician and understand that there are some conditions where it could quite clearly harm you. So the question in the chat is, does caffeine affect how long you sleep or the quality of sleep once you are asleep? And the answer is yes and yes. Caffeine can make it harder to fall asleep. It can also make your sleep lighter, depending on how much you have consumed. And if you have lighter sleep, that means that any noise, any movement, getting up to go to the bathroom will wake you up more quickly and also more completely. Caffeine has a half-life, in other words, how long it takes your liver to process it, of, I believe, 8 to 12 hours. So if you have a cup of coffee at noon, the chances are by bedtime, there is still maybe 20 or 30% of that caffeine still circulating in your bloodstream. There are some people who are fast metabolizers of caffeine. It's a production of an enzyme. I have that enzyme, luckily enough. I did genetic testing and proved it, but I knew that in my 20s. There are people that have exactly the opposite. They are very poor metabolizers of caffeine, and they don't need a genetic test either to know about it. They know 1 cup of coffee after 9 a.m. and they will feel it. So I want to talk very briefly about what happens to sleep as people age. Everyone is different. I have a friend who's 75 and whose sleep is just, and the envy of people half her age. She's unusual in a lot of other ways too, but she's not here tonight because she doesn't need to know anything about how to sleep better. Lucky her. So there are 4 things that change as we age. Most people find that they sleep less overall. People that were used to getting a solid 8 or 9 struggle to sometimes get 6 or 7. The quality of sleep does decrease. This will include shorter and more shallow deep sleep phases. Sometimes it includes shorter and less intense rapid eye movement sleep, the one where you dream. Sometimes it increases. So people have tremendous amounts more dreams, but in general, that's decreased. The only way you know that the quality of your sleep has decreased is how you feel. The clinical way is to do a sleep study, and most of us will not end up being scheduled for an overnight sleep study in our lives. What you would feel if the quality of your sleep is not good is that you would feel that you haven't slept, even though your bed partner says that you've slept, or the clock on the in your bedroom says you definitely have slept. or feeling tired even though you knew you slept. So getting up and not feeling refreshed. That would be an indication that your sleep quality is less than it should be. You can also end up with something called decreased sleep efficiency. You spend the same or even more time in bed, but you're awake for more of that time. And the last one is disruption in the timing of sleep. Usually for older adults, going to bed earlier and waking earlier. There's a scientific term for that. It's called advanced sleep onset. And so why are those problems? They're problems because poor sleep makes us feel less energetic and does affect our health. It can make it harder to enjoy life. Most people don't want just a longer life. They want a longer health span, which is the way researchers talking about it. Just a longer period of time where you feel good and you can be active. Nobody, absolutely nobody retires so they can sleep badly at night and then feel sluggish and irritable all day long. The science of sleep is growing every day. I'm fascinated by it, but all of my friends encouraged me to go light on the science and heavy on the solutions tonight. So that's what I'm going to try and do. I could spend hours talking about what I know about sleep science. I will just simply say that the evidence is pretty incredible that poor sleep affects almost every aspect of health. So if you have a health challenge, getting better sleep almost certainly will improve it in some way. And it also has a massive effect on mental health. So if you have any mental health challenges, getting poor sleep is unfortunately incredibly common. Dr. Walker said in an interview that's up on YouTube that they have yet to find any mental health challenge where sleep is not an issue. That's a pretty strong statement, but it's a pretty accurate one. Optimizing your sleep is one way you can improve your health. It isn't expensive, it doesn't have side effects, and the dividends are paid to you every single day. I don't have any other investment that's as good as that. There are some physical things that happen to make it harder to sleep. There are also some really good things that happen as you age. You get more perspective, you generally get more wisdom. You know who you are and you know what you want. And that is what I encourage people to capitalize on when they want to address the sleep problems that they have. Unfortunately, a lot of people end up with a number of physical challenges, usually more than one as they age. The nutrients that support good sleep are harder to metabolize. You may be eating the same diet that you did 40 years ago in the same amount, but your body may not be able to have what's called bioavailability, being able to take the nutrients from the food and deliver it to your body. That is not something you can change with exercise or changing your diet. I think most people do know that taking mega doses of vitamins and minerals can be dangerous. So you really don't want to do that without speaking to your physician. When you stop working and your daily routines change, that can actually affect your sleep. It can affect your health because sleep is one of those things that's in a rhythm. You know, people have probably heard about the circadian rhythm. It turns out your body and your different organ systems all have their own rhythms. And the circadian clock is kind of the master clock, but it's heavily influenced by wake and sleep cycles, eating cycles, exercising cycles, and activity cycles. But in retirement, a lot of people have variable routines. They don't have to be at work at 9. They don't leave at 9. They don't exercise at exactly the same hours. That I think that's an underappreciated effect of retirement on sleep. So I'd like to go right into solutions. But I would also like to ask if anyone has questions that they would like to specifically ask about. If it's a section that I'm going to talk about in solutions, I will let you know so that I won't be repeating myself. And feel free to type something into the chat as well. So you can unmute yourself to ask a question verbally, or you can place it in the chat. All right, then I'm going to jump right into solutions, because I would like to be able to have time at the end. So, improving your sleep after 60 can take time and effort. It is not a surprise to me that people would rather have a pill than a program. The biggest problem is there's no clear winner in the medication race, and the loser is often the patient. Sleep medications, including the ones you see advertised on television, all have side effects. The advertiser goes, either says really quickly what the side effects are, or puts them in microscopic print. There's a reason for that. They really don't want you to know what the downside is and the side effects for drugs. Behavioral treatments for sleep problems have been proven to be as effective as drug therapy for addressing non-medical sleep problems. Medical sleep problems would be things like obstructive sleep apnea, restless leg syndrome, narcolepsy. Those do need medical treatment, but for sleep problems that are not clearly a physical sleep disorder, there's actually studies that prove that behavioral strategies done correctly, done to evidence standards, work really well. And this isn't my opinion. In 2016, the American College of Physicians put out a clinical guideline statement. It says that CBTI, cognitive behavioral therapy for insomnia, they consider it to be the first line treatment for non-medical sleep problems. And in addition, if you have a problem that has to be treated by a CPAP machine or medication, what's rarely discussed by your physician is that before you got that diagnosis and the correct treatment, you probably developed a lot of bad habits around sleep. And you also developed quite a bit of anxiety about sleep. That doesn't evaporate when you get a CPAP machine. I work with people to allow them to tolerate wearing a CPAP machine. Most people do not enjoy having something strapped to their face, even though they understand full well how important it is for their health. And there's no question that older adults have to manage, their medical issues, including chronic pain, having a great diet, being able to exercise. There are things like pelvic floor issues, not just for ladies, for men as well, that could need treatment. By the way, if anyone wants to contact me, one of my friends is an excellent pelvic floor therapist. She's in Eastchester. She has an office, if you're interested. And people also need to think about their medications. Some commonly prescribed medications taken at the wrong dosage or at the wrong time can massively impact sleep. There's the Jean Higgins put in the chat. Lately, I find I have to fall asleep on I'm going to assume that's a couch with the TV volume low, and then I can spend the rest of the night in the bedroom. I definitely want to speak in a minute or two about what happens when you fall asleep in a different location than where you plan to spend the rest of your evening. One of the things that's really not said that much is a lot of older adults raise children. Sometimes they care for grandchildren. So we know what happens if you rock your baby to sleep in the living room and he is fully asleep and you put him into the crib and he goes through a few sleep cycles and then wakes up to find himself in a different room. Generally, there's a lot of screaming involved with that. If you can imagine someone doing that to you and not knowing how you got from the couch to the bed, that can be really difficult. The interesting part is your brain knows that too. And we develop habits about where we fall asleep and under what circumstances. So just like not, not allowing a baby to fall asleep in one location and then transplant them fully asleep to another, it is not uncommon for people to nod off on the couch and then drag themselves to sleep. And people might even say, oh no, this works really well for me, I sleep better. You may not be getting very good sleep quality. You may indeed be sleeping what you believe to be enough hours. The problem is that because it's fractured up like that, we know that fractured sleep delivers a lower quality of sleep. So what I'm going to say about speaking with a physician about your medications, because if you spend tomorrow looking up some of your medications and specifically how they affect sleep, you might be shocked to find out that you are on more than one medication that that negatively affects sleep. That's a hard conversation to have. I am not a prescriber, but I am a healthcare provider. So I thought of 4 suggestions for people. One is, please never change or stop your medications without discussing this with the person that prescribed it. That could endanger you. So even if you are horrified at what you see online, please have a discussion first. When you speak with a prescriber about your concerns, give them as much detail as you can about your symptoms. What's happening with your sleep, how bad it is, how often it's bad, and how much of a problem that's turning out to be in your life, what makes your sleep worse, and even what makes it better, including falling asleep on the couch first and then going and then continuing on to the bedroom. By giving prescribers more information, that gives you the best chance to get a really positive response and an effective response. I will want to tell you about one of my friends who is almost 80, and she was very unhappy with how much she was getting up to pee at night after her doctor gave her 2 blood pressure medications, and her blood pressure was extraordinarily high. I mean, the kind where people in the ER go, we might have to admit you for that. And she did decide that she was going to decrease how much she took. That wasn't my recommendation, but you don't tell her what to do. She tells you. And it did turn out that taking a diuretic pill, a water pill is what she called it, at bedtime meant it was most effective in the middle of the night. It was pulling fluid out from around her heart and in her legs and putting it right into her bladder, and she was peeing 4 times a night. And she also was on a very large amount of blood pressure medication, again, that she was taking directly at bedtime, which meant that when she stood up those 4 times to go to the bathroom, she felt dizzy and nearly fell quite a few times. She went to her prescriber and described this, and guess what? Both pills were cut in half in terms of amount. She had to have them herself, which I didn't recommend. And she admitted that she'd done that, but the prescriber, after taking her blood pressure and talking to her, first said you could take it earlier in the day, and then said, well, since your pressure right now is so good, I guess you can continue to take less. So I just wanted to share that story, because that is someone who was really, really struggling. She was afraid she would break a hip, and that would end her independent life in Brooklyn. So let's take a look at some of the most common problems and solutions. So the first one I want to talk about is going to bed early and also waking up early in the morning. As I said, doctors have a name for this. It's called advanced sleep onset. And not everyone thinks that's terrible. My friend who's 75 and has no problem sleeping, she wants me to speak with her when I'm done with this. She probably will go to bed by 8 p.m. She'll wake up around 4. She doesn't have a problem with it. She's organized her life around that. But some people really find that they miss social activities. They are falling asleep and when they don't want to fall asleep, and they are up with the chickens hours before the sun arises. So the strategies that I'd like to suggest for that, would be to move bedtime and a little bit later over many weeks' time. No one encourages people to do what's called social jet lag, which is to just force yourself to stay up 2 hours later than you would normally. Most people can't move their bedtime more than 10 or 15 minutes later and be effective. Though the same thing has to happen with daily routines. In other words, breakfast gets moved later, exercise gets moved later, everything moves later, but very gradually. There's no question that in changing your environment to stay up later is really helpful. Dr. Walker's favorite is to encourage people to get more natural light exposure in late afternoons. So what he tells people is, if you take a morning walk, wear sunglasses. But if you take an afternoon walk, wear a hat, but don't wear sunglasses. Let your brain receive the input of natural light. Don't look straight at the sun, but get a lot of natural light late in the afternoon to push back your brain's secretion of melatonin. You want it to be later in the day. And definitely don't nap. If you absolutely must nap, if there's no possible way you can stay awake, he encourages you to never nap after around 2 in the afternoon. Nap and nap for 20 minutes, which my friend in Brooklyn thought was outrageous. She loves to take a long nap on Shabbos, but that probably is making her sleep during the rest of the week very, very strange. It would be like flying to Los Angeles every Saturday and then coming back every single Saturday. The final suggestion about naps is to make them at exactly the same time of the day. So that's really hard for most people to do. Most people have other things to do. But if you are finding that you are not sleeping the way you want to, then eliminating naps is probably a very, very good idea. I mentioned that one of the reasons that people get up to go to the bathroom very frequently at night is the medications that they're taking and the timing of it. If you can avoid dehydrating yourself, if you increase your hydration during the day and decrease how much you're drinking at least a couple of hours before you go to sleep. There are a lot of older people who have swelling in their legs. And for those people, lying down is now allowing their circulation to move all of that accumulated fluid into their vascular system and then up into their kidneys. So for people that have a lot of swelling and wake up in the morning and go, look at that, I must have peed it all out in the 5 times I got up. Those people need to elevate their legs a couple of hours before bedtime in order to help their body move some of that fluid out while they're awake and not when they're sleeping. Interestingly enough, one of the less understood by non-physicians reasons to get up to pee is obstructive sleep apnea. When we are in deep sleep, our brain secretes an anti-diuretic hormone. It basically stops us from creating urine. But if you have very light sleep, that hormone is not secreted. And so your kidneys are thinking it's 10 in the morning and they get to work. And again, if you have pelvic floor issues or prostate issues, getting treatment for those problems can make a massive difference, and not necessarily medical problems. Physical therapy can be a godsend for pelvic floor issues. Another problem, and actually my friend who sleeps perfectly said, well, what about drinking wine? And that's where this turns into show and tell. So there's alcohol-free beer, but a lot of people don't drink a beer with dinner, they drink wine. So I personally tested out as many de-alcoholized wines as I could. I couldn't find a red wine that didn't taste like grape juice. But I found 2 white wines that smell like wine and taste like wine and have no alcohol. The one I like the best is this one. It's a New Zealand Sauvignon Blanc. It even, has a nice bottle. It looks like wine, it smells like wine, it tastes like wine. This is a German Riesling from Leitz, L-E-I-T-Z. It's hard to see the label. And those diminish the alcohol you take in the evening. And sparkling beverages, sparkling fruit beverages kind of feel a little bit like champagne, but don't have any alcohol. What we know about alcohol and sleep, I'm sorry to say, none of it is good. We know that the liver processes alcohol about 4 to 6 hours after you have consumed it, which means it acts as a sedative immediately. Most people like a nightcap, they like a glass of wine to relax, and they find that they are awake too much in the middle of the night. There's a biological reason for that, and there's not much you can do about it. You can either accept it or you can drink something else. Dr. Walker's from England. He said, you can just go to the pub at noon, but, and he's not really joking, except he is. So those are my suggestions. A lot of people that I know that are over 60 say that they don't fall asleep easily. And there's no question that the biggest problem is worry. So the program that I was trained in has a whole module on managing nighttime worry. I encourage people to have a cool bedroom. These are all sleep hygiene strategies, if you've ever looked up sleep hygiene. And sleep hygiene makes a lot of sense, but there are some targeted ideas on how to fall asleep more easily. One of them, the most important one, according to the person who signed my certification form, is to set an alarm in the morning and don't use the snooze. In other words, you can't really time when you fall asleep. You just can't. You can time when you go to bed, but you can't time when you fall asleep. But you can actually start the biological clock on time by setting an alarm and getting up. And when she says get up, she means get out of bed, turn on all the lights, open the blinds, and get that natural sunlight to switch your brain to awake. I definitely encourage people not to spend a lot of time on focused media an hour before bed. I personally think a lot of people can make changes during the day. So that's where this comes in. This is a full spectrum light bulb I bought on Amazon. And so during the day, getting that full spectrum light really tells your brain this is daytime. And then when the lights go off and you dim the lights in your home at night, then your brain knows it is time to sleep. And that helps your biology know that it's time to fall asleep. When people wake up and they can't fall asleep, often psychologists and sleep therapists will say, get out of bed. If you cannot fall asleep after 20 minutes, get out of bed, do something repetitive and boring in dim light. The reason for that is you want to train your brain only to sleep in bed. Actually, that's not true. There are 2 things that they recommend you do in bed. One of them is sleep. You can think of what the other one is. Some therapists recommend that you have a back to sleep thing, something boring to read. I told one of my clients, I said, if you're going to turn on the television before you go to bed or in the middle of the night, tune into National Geographic Channel, The Lizards of Borneo. Unless you're a lizard person, you really want to be lulled to sleep. You don't want anything interesting going on. You're not going to read your social media feed. Boring, boring, boring. Some people use prayer, some people use meditation. Dr. Walker recommends that instead of counting sheep, what you do is mentally take yourself on a walk. Use all the senses to imagine what it looks like, smells like, feels like, sounds like. But take yourself on a walk. I live here in Irvington, so I imagine being down at the Riverfront Park, which I love. I'm down there all the time. Some people feel when they wake up that they feel spacey or disoriented. That is called sleep inertia. It is actually normal. The poorer your sleep is, the more likely that your sleep inertia is longer lasting and more intense. You want to make sure that your medications are not still having, your sedating medications are not still sedating you when you wake up. And definitely getting bright light will help. When you wake up, turning on the lights will definitely help. In terms of falling asleep on the couch, and or in the movie theater or at the dinner table. I actually have a friend whose husband falls asleep on the dinner table, but then he's up at 3 in the morning. I stayed in their home and he was indeed up at 3 in the morning. All of the strategies that I talked about, trying to decouple sleeping anywhere else but your bed will enhance your ability when you do get into bed to fall asleep. Getting all that natural sunlight, and not wearing sunglasses in the afternoon, avoiding alcohol. And there are 2 other strategies that I can think of. One is to reduce the amount of carbohydrates you eat in the evening, having your largest meal and your biggest meal in the middle of the day. And the last one is checking your hearing. Because if you're watching a show, if you're at a performance and your hearing is limited, you're not getting the stimulation that would keep you up. So if sounds are muffled, or if lights are muffled, that can actually tell your brain that you're not that you are ready to fall asleep. I would like to invite anybody that has any questions to unmute and ask specifically, or to type things in the chat. I kind of fast, and I certainly didn't say every possible strategy that I know to help sleep. I tried to hit the things that I knew were the most common problems in sleep after 60. But I'd really love to hear from people, and if they have any specific questions.
I am going to go ahead and stop the recording here just so people feel a little more free to speak up. And